How many of you are familiar with the technology? So the next half an hour will all be about technology, stuff that's actually used in theaters. I'm assuming some of you are familiar with it, some of you aren't. Just a very quick raise of hands. How many know about navigation and navigation in spinal surgery? Okay, I probably expected that. How many are familiar with GPS, car navigation system? Everyone, right?
Just note, my hand was down for that.
I don't think you need that.
No, it takes me to rivers and stuff. But, yeah.
So I'm going to start with a very basic introduction to what navigation is and how I think the technology itself is about 20, 25 years old now. It's standard of care in NHS, essentially. So if you're doing complex spinal surgery, that is something you've got to have. And I'm sure, Rafid is going to vouch for that as well. But if you just look on your screen on the left-hand side, the top left of the screen basically just shows you how a car navigation system works. So there are three components. So you've got a satellite, which you guys don't see. You've got the car itself, which talks to the satellite, and a map. Very similar to that in spinal surgery. You've got three components, and you see that here. There's a camera, which is just underneath the satellite. You've got an instrument, which Rafid has in his hands as well, which is like a car. And you've got map, which is either a patient's brain or spine, essentially, which could be MRI, CT, or any type of 3D imaging modality that can be used. So it's very similar. So if on the right you see how that system appears in a theater environment, essentially. And I think we've set up, as I said, we've set up a hands-on. So the best thing would be to come and experience it and kind of touch the spine yourself to see how it actually works. But the concept is, the basic concept is like a car navigation system, essentially. Again, what's the main reason of that being used? I mean, it's not an exhaustive list, but these are some of the benefits of using navigation in complex spine surgery. I have divided into two parts, essentially. So I think the first aspect is around patients. And the second at the bottom is around more the benefits for the surgical and the clinical team, essentially. I mean, over the years, and again, Rafid can talk about it a lot more than me from a clinical perspective, but, the surgical intervention has become more and more minimally invasive, which means the visualization, for example, of spine during a procedure is less because you're trying to make incisions much smaller. So therefore, you need tools like this, which allows you to visualize the area of interest that you're operating on, for example, but through a smaller hole, essentially. So that's where this type of technology actually works well. So I always like to say that sometimes navigation is about you driving a car into a new city without knowing where to go. If you don't have navigation, would you be able to get to your destination? In an easier way. Similarly, for a spinal surgeon, he's looking at a different spine every day, and they have to, rely on their anatomical knowledge traditionally, but this tool gives them the right information almost live. Again, that's led to advantages like reduction in revision cases. So before the patient leaves theater, the surgeon is able to know using the 3D imaging, for example, that the screws have gone in the right place, essentially. And accuracy has increased drastically. So, we generally claim it's between 98 to 100% accuracy with technologies like these, essentially. For the surgical team, there are several advantages. I think one of the biggest one is that most of the spinal surgery is done under fluoroscopic imaging, which has now, there's a lot of evidence that there's things like sort of cancer and stuff that's related to the healthcare teams, basically, because they're exposed to radiation a lot. This technology reduces that to almost zero. And again, as I said, because of visual, because of the anatomy being, available on a screen to the surgeon, they can be as accurate as, up to 1 or 2 millimeter. Of the pinpoint, of their instrument, essentially. So these are some of the benefits, really. So I don't know whether should play the quick video just to show
Is it long?
How everything comes across. Probably just a 1-minute video just to show.
Yeah.
It's a bit Medtronic focused, guys, sorry, but hopefully it gives you a good idea.
I mean, it's okay with the sound off anyway.
Procedures.
Yeah.
From the single-level fusion to the most complex. With increased visualization, instrument choices shown the way you need. With your input, we've developed a system that's designed to let you do more. Introducing Stealth Station S8. This powerful system gives you automatic registration to intraoperative O-arm images. Seamlessly utilize your wide range of navigated spine instruments. With the Stealth Station S8, actively navigate an instrument while configurations of another are changed, delivering what you need when you need it. A system designed for the procedures you perform. A system of software, imaging, and instruments that give you the flexibility to do what you need. Every detail is engineered to exceed your expectations. The technology you choose is a reflection of your work. Only the best tools for the best care. You are Stealth.
I'm going to go out and buy one right now.
Sorry about the Americanization of it, but
No, it's fine. No, it's good. Thank you, Naren. I mean, we've jumped in quite a big difference between the session before lunch and now. And it's like not just technical, but we've gone into heavy metal technical, as it were. But I think, yeah, I think it's interesting and fun for anybody who's never seen a surgery even. Just have a go, because we're going to have it set up on different stations. And you'll find it fun. It's like doing any DIY kind of school thing. I think you'll all enjoy it. Usually we get good feedback from these sessions. So we've got the, should we set up, Taylor? Let's just set up. So we're going to put, yeah, and please all get involved. If you don't want to, you don't have to. But we're going to have four different models on the tables. Should we do? And then and the guys will lead it. Anybody who wants to come around here is welcome. I'll take my mic off so that I can start to look in.